Men with nerve damage have about a 71% higher chance of developing ED. Erectile dysfunction is a serious red flag indicating that there's blood vessel damage throughout the body. I'm going to talk to you about a topic that no man likes to discuss, erectile dysfunction. Have you ever wondered why erectile dysfunction can feel like a mountain you just can't conquer? It's frustrating, isn't it? Well, you're not alone. 30 million American men are affected by this, and 50 to 75% of men with peripheral neuropathy will experience some degree of erectile dysfunction. And worse yet is the reality that ED can increase with the severity of your nerve damage. But here's the good news. There's a tremendous amount of research that's revealed effective treatments to restore normal, healthy erectile function. So you don't have to depend on drugs like Viagra or Cialis for the rest of your life. In today's video, I'll uncover many of the causes that may have led to your ED, and more importantly, I'll show you what you can do to reverse this condition and restore normal function. This is going to be good. Don't go anywhere. All right, health warriors, let's dive in and tackle this epidemic of sexual dysfunction. Both men and women suffer from sexual dysfunction, but today we're focusing on ED in men. Most people don't realize how serious and widespread this issue is. The fact is, when a man suffers from ED, it's a red flag that he has significant vascular damage to his blood vessels, and it's also a sign of cardiovascular disease. So let's look back in time. In 1995, ED affected 150 million men worldwide. In 2025, it's projected that 322 men worldwide will be affected with ED. This was published in the British Journal of Urology International. These are astronomical numbers, and the only groups pleased by them are the drug companies Pfizer and Lilly, the makers of Viagra and Cialis. Now, let's look at what age groups are affected. 52% of men between the ages of 40 to 70 suffer from ED. Health warriors, in case you don't know, your sexual prime should still be going strong when you're in your 40s, not declining. But statistics continue to show that 40% of men in their 40s are affected by ED, and 70% of men at age 70 suffer from ED. Okay, what about men 39 and under? Surely they're not experiencing any sexual dysfunction, right? Well, think again. 25% of men under the age of 40 suffer from ED. But it's not just erectile dysfunction we're talking about. A clinical study done in 2019 on 12,000 men found that 1 out of 20 men reported low sexual desire, also known as low libido. So let's make sure you understand what ED really is, because it's not simply about no erection. ED includes a spectrum of issues spanning from difficulty achieving an erection to difficulty maintaining it throughout intercourse. So if you feel like your sexual function isn't what it used to be and you're wondering if it's ED, here's some subtle signs you can look for. Reduced rigidity. You may get an erection, but it lacks the firmness needed for penetration or satisfaction. Another sign could be difficulty maintaining an erection. You may start with an erection, but it's short-lived, meaning you might go flaccid before actual intercourse or even during intercourse. Another symptom may be lack of spontaneous erection. You may experience a decline in erections that typically occur while you sleep or early in the morning. Another common symptom is delayed or reduced responsiveness. Your erection may take longer to achieve even with adequate stimulation. Another symptom often reported is decreased libido. Sexual arousal, often initiated by a healthy libido, triggers the release of nitric oxide and other chemical molecules that increase blood flow to the penis, resulting in an erection. But if your libido is low, this can interrupt this process, making it more difficult to initiate or maintain an erection. Okay, let's turn our attention to some of the causes at this point. It's important that we go over the causes before the treatment. Otherwise, once your function is restored, you'll run the risk of developing ED again. The most common cause of ED, hands down, is vascular disease or heart disease. Chronic heart disease due to atherosclerosis or plaquing of the arteries. High blood pressure or vascular damage can impair blood flow to the penis. The second largest cause of ED among men is diabetes. Up to 50% of men with diabetes will experience erectile dysfunction. But if these men also suffer with diabetic neuropathy, then the risk of developing ED skyrockets up to 75%. ED can also occur due to hormonal imbalance. The obvious hormone is low testosterone, often referred to as low T. Unfortunately, the average doctor is clueless about optimal range of your testosterone levels, so you really want to get this tested by a doctor who specializes in male andropause or bioidentical hormone replacement. Now, you're probably wondering, what is the optimal level? What's a normal testosterone level? The lab will list normal testosterone levels in the range between 249 nanograms per deciliter to 1070 nanograms per deciliter. Now, this is a really wide range, and I can guarantee you a man with T levels in the 300s does not function the same as a man with T levels in the 700s. Unfortunately, the average doctor will look at your lab values, and if you're 60 or older, they'll say your testosterone is normal. Now, trust me, it's not, and you certainly won't feel your best. Low T will cause you to feel lethargic or lack of energy. It'll slow down your recovery, nor will you be able to sexually perform the way you once did. Now, optimally, total testosterone should be in the range of 600 to 1,000 nanograms per deciliter, and your free testosterone should optimally be in the range of 15 to 25 nanograms per deciliter. You'll need both of these testosterones tested. Your total testosterone numbers will show the quantity of your bound testosterone, along with your free testosterone, which is really the testosterone readily available for use by your body. Free testosterone provides a much clearer picture of the bioavailable hormone you have. Now, that's the obvious hormonal imbalance, but I want you to be aware that hypothyroidism can lead to reduced testosterone levels. So it's a good idea to have your thyroid function checked as well. Now, the third cause of ED is peripheral neuropathy. Peripheral neuropathy and erectile dysfunction are closely linked due to the role of the nerves in controlling blood flow, muscle responses, and sensory feedback in the body. Most people familiar with peripheral neuropathy associate it with the feet and legs or the arms and hands. Damage may have occurred to the sensory nerves or the motor nerves that control messages to these limbs. But there's another category of nerves in your peripheral nervous system, and it's called the autonomic nerves. These nerves handle all the things your body does without you having to think about them. They control heart rate, breathing, digestion, blood pressure, bowel and bladder function, and yes, even sexual function. Your genitalia, and in this case your penis, depend on a healthy autonomic nervous system. These nerves control the blood flow to the penis for an erection or the relaxation of smooth muscles in the penis. When these nerves get damaged, the signals required for an erection are disrupted, which can result in reduced sensations to the groin or the pelvic region. It can interfere with erection reflexes and ejaculation or other issues that we mentioned earlier associated with ED. It can even result in neuropathic pain in the groin or the genitalia and the pelvic basin. Remember, statistics prove that 50 to 70% of men with peripheral neuropathy will experience erectile dysfunction, and there's a specific reason for that. Peripheral neuropathy and ED often share common causes like diabetes, poor circulation due to damaged blood vessels, nutrient deficiencies, especially the B vitamins, magnesium or zinc, which can impair nerve function to the genitalia and can impair testosterone production, both contributing to ED. This is the exact reason more and more of my neuropathy patients are asking me if there's an association between their ED and neuropathy. And yes, there is. Now, let's look at another common cause. Did you know that many medications cause ED by either interfering with hormones, neurotransmitter balance, blood flow, or nerve function. So here's a class of medications that can result in ED. It could be antidepressants, antihypertensives, also known as blood pressure meds, antipsychotics, anti-seizure drugs, corticosteroids like prednisone, anti-ulcer medications like cimetidine or Tagamet, Prilosec or Nexium, and even regular antihistamine use with medications like Benadryl or Claritin. Other causes of ED that often go unnoticed are obesity, crappy diet, and bad lifestyle habits. Obesity and lack of exercise impair testosterone production. A poor diet along with smoking or chronic or excessive alcohol use causes systemic inflammation leading to damaged blood vessels. The last cause I'll mention is nutrient deficiencies. Deficiencies of B vitamins, especially B12, along with the zinc deficiency and low or deficient levels of vitamin D can all lead to ED. Now, let's go over what you can do about all this to restore health and function to your autonomic nerves, your blood vessels, and to regain normal sexual function. Addressing ED requires a comprehensive approach of systemic healing. The first thing you have to do is to improve your vascular health. Then you have to address healing the autonomic peripheral nerves. Next, you need to balance your hormones. And lastly, you need to reduce inflammation. Let's start with improving vascular health. Now, let's start by looking at how we can improve blood vessel health and circulation. Poor circulation due to damaged blood vessels reduces blood flow to the penis, a primary cause of ED. So start with boosting nitric oxide levels in your body, which acts as the body's on switch for an erection. Nitric oxide, or NO, is critical for vasodilation, which is widening of the blood vessels, allowing more blood flow into the penis. This is essential for achieving and maintaining an erection. It's also a necessary part of the nerve signaling during erection. So a simple, inexpensive solution lies in a naturally occurring amino acid called L-citrulline. L-citrulline is a game changer because it drastically boosts nitric oxide production. Here's how it works. When you take L-citrulline, your kidneys convert it into L-arginine, a different amino acid. L-arginine is used by an enzyme called nitric oxide synthase, or NOS, to produce nitric oxide. And nitric oxide is the magic key that unlocks the blood vessels, improving blood flow to the penis. This is the foundation of a strong and lasting erection. Now, you might wonder, why not just take L-arginine directly? I get asked this question all the time. Well, when you take L-arginine orally as a pill or a powder, much of it gets eliminated by the stomach bacteria and arginase enzyme in the gut and liver. So most of it is broken down before it can ever be used to make nitric oxide. On the other hand, L-citrulline doesn't get broken down by stomach bacteria once ingested. It will go to the small intestines and then into the bloodstream, completely skipping the liver, avoiding breakdown. Here are a few other reasons why taking L-citrulline is a better option than L-arginine. L-citrulline is better absorbed by the body in larger quantities. L-citrulline raises L-arginine levels in the blood more consistently and for a longer period, keeping nitric oxide production steady. While L-arginine, when it does reach the bloodstream, has a very short half-life of about 1 to 2 hours due to its rapid breakdown. This limits its impact on nitric oxide production. And let's not forget, L-citrulline is easier on the stomach. High doses of L-arginine can cause digestive issues like bloating or diarrhea, but L-citrulline is generally well tolerated. Okay, let's talk about how much you need to take. Research shows that taking between 2 grams to 6 grams daily are beneficial. The longer you've had the ED or the more severe, the higher the dose you'll need. We always recommend starting out at a lower dose and then gradually working your way up to the maximum amount as outlined by research. Next, don't forget to incorporate nitric oxide rich foods. These foods will help maintain steady nitric oxide levels in your body. Unfortunately, if you already have ED, eating these foods by themselves probably won't reverse your condition because you wouldn't be able to eat the huge volumes that would be necessary to produce nitric oxide levels. But adding nitric boosting foods like arugula, beets, cilantro, and others is definitely beneficial. If you want to learn more about this, check out these two videos. Not only will boosting nitric oxide improve your sexual function, but it will also improve your systemic health of all the blood vessels. Okay, number 2, restoring nerve health. The next thing you need to do is restore nerve health to the autonomic nerves that have been damaged. Research has shown that utilizing photobiomodulation, or PBM, applied directly to the pelvic area, which is the lower abdomen, and the perineum, the space between the genitals and the anus, repairs damage to the autonomic nerves affecting the penis and stimulates nerve regeneration. It also assists in repairing damage to the blood vessels and improves blood flow and circulation, which enhances nitric oxide release. Now, one thing I want you to understand is if you're already using PBM on your limbs like your feet or legs, this application will not repair the autonomic nerves. Now, the best wavelengths shown in research for supporting erectile function fall within the range of 800 to 1000 nanometers. These wavelengths penetrate deep into tissue, reaching blood vessels, smooth muscles, and nerves critical for erectile function. When dealing with autonomic nerve damage leading to erectile dysfunction, you will also need to supplement with critical nutrients necessary for nerve repair. Things like methylcobalamin, R-alpha-lipoic acid, pyridoxal 5-phosphate, benfotiamine, folate, and acetyl L-carnitine. These are all essential nutrients for nerve repair. We use a formula called Euphoria Gold for our patients that contains all of these ingredients. Number 3, restoring hormonal balance. Don't forget to have your hormone levels analyzed because if you suffer from low testosterone, this will need to be addressed. One supplement that has been shown to successfully elevate testosterone levels in men by 30 to 60% is D-aspartic acid. Research has shown that supplementing with 3,000 milligrams will raise T levels. You want to cycle on and off of these supplements, taking them on for 2 to 4 weeks and then taking a break from them for the next 2 to 4 weeks. This prevents desensitization to maintain its effectiveness. Additional supplements you may need include zinc. This is essential for testosterone synthesis, and you'll need 15 to 30 milligrams daily. Another essential vitamin is vitamin D3. This regulates testosterone production, and most people have very low vitamin D. Your vitamin D levels on your labs should be somewhere between 60 to 100 nanograms per ml. Ashwagandha is an herb found to be effective to enhance T levels up to 22% as shown in studies. It works by reducing cortisol levels which suppress testosterone. 300 to 600 milligrams are recommended for standardized root extract. And last is magnesium, which has been shown to indirectly support testosterone production. Studies recommend taking 200 to 400 milligrams daily. One other important point, if you're a pre-diabetic, diabetic, or if you suffer from heart disease, you must change your diet. There's just no way around it. Otherwise, it'll be like climbing up a steep hill. There will be obstacles that will constantly slow you down or barricade your progress altogether. Look for either an anti-inflammatory diet or a healthy keto diet. And that's it, health warriors. I know erectile dysfunction can feel overwhelming, which is why I want you to leave this video feeling empowered. Because here's the truth. Erectile dysfunction isn't the end of the road. It's a call to action. It's your body's way of telling you it needs some attention, some healing, and some care. And the good news? You have all the tools and knowledge to take control. Science has given us powerful strategies to reverse ED, repair nerve damage, and restore vascular health. You don't have to rely on quick fixes or temporary solutions. Real lasting change is within your reach. Your body is designed to heal itself, and with the right support, it will. So start today. Make one change. Take one step and trust the process. You're not just fighting ED. You're fighting for your overall health, your relationships, and your happiness. And I know you've got what it takes. I believe in you. Now, let's make it happen. And I look forward to seeing you on the road to great nerve health. I'm gonna. Hang on.
I'm gonna.
So if you feel like your sexual function isn't what it used to be, and you're wondering if it's ED, here are some subtle signs you can look for. Yeah. Here are some subtle signs you can look for.